Well, I'm very happy to be able to be with you all on this morning. My name is Shadun Duncan, as Quabilla's already mentioned. I'm with Mid-South Health Systems. I am a licensed mental health counselor and also a certified substance abuse counselor. My official role here is the Vice President of Grants and Business Development. I've been with the Mid-South Health Systems Legacy Agency for just shy of 25 years. So in August, I'll be here for 25 years. So I've been around for a little bit.
Oh, wow. So that shows that you are passionate about your job. It's not just a job for you. And that's one thing I love to hear, that when people are in certain roles for a certain amount of time, it shows their dedication to the people they serve. It's not just, oh, I'm going to work at this place because whatever. You have a dedication to helping people get better in whatever that looks like for them and in
Absolutely.
whatever capacity that means.
Right. Right.
Okay.
I came into this field with that hope and with that expectation, and I really believe that that's what's kept me around for this long. Wanting to really be able to make an impact on people's lives.
That's awesome. And so you all have a service that's um, coming up. I don't know if it's already started, and please help me out with the details on that. A
Okay.
certified community behavioral clinic. So let's get deeper into that, and how did that come about, and how is it funded?
Okay. So Mid-South Health Systems is the state contracted community mental health center serving this area. So we serve 20 counties here in Eastern Arkansas. Been around for more than 50 years providing these types of services. And
Wow.
our target population is generally individuals that have serious mental illnesses, youth and children that have serious emotional disturbances, individuals that have substance use disorders, and also co-occurring mental health and substance use disorders. So, we've been providing these services for a long time. The Certified Community Behavioral Health Clinic funding that we received is funding that we received from the Substance Abuse and Mental Health Services Administration. It's a 2-year project that allows us to expand upon the services that we're providing to their population. Really to have a more holistic approach to service delivery. So it's not just focusing on, their mental health issue or their substance use issue, but also issues that impact their primary health. So I think I'm probably most excited about that component at this point because it's something new that we're able to begin to implement. Because a number of our individuals that we serve have primary healthcare issues that are further complicated because of the presence of their mental health issues. So I think it's a great opportunity to really, address the whole person and all the issues that are impacting them.
Yes, indeed. I have some more questions and comments, but I want to say good morning to some of your, friends, followers, your church members. Uh, Keisha Higgins. Good morning. There's my boss, Christy Mathis Conway. Good morning, and thank you to Ty Jackson, Letha Prunty, Vicky Thomas for checking in. Please share this information. We want to get as many people help as possible through this program. And so, as you're talking about taking care of the total person, I'm in a class, even though it's about global stratification, we were talking this week about resiliency.
Mhm.
And oftentimes it seems like now we're in a phase where people are just kind of expected to get over. We focus on the how quick somebody bounces back versus what are the other underlying traumatic issues
Right.
there that are not being addressed, or they're being treated with medicine, or they're just being kind of, it's like we're pushing people to get over and move forward versus let's really treat all these other issues that are surrounding what led to that behavior, that trauma, that whatever. And
Absolutely.
so I love how you mentioned, okay, let's go back, let's take a look at everything and get to the root of the matter of why this person is acting, doing, and why they're feeling and whatever.
Right. I
Um,
think it's really good that you mentioned the trauma aspect of it because trauma informed care is a component of what we're offering through this initiative in this program. And it's really not just about, only the trauma of the individuals that we provide services for, but also trauma that may impact our staff. Because secondary trauma is a real thing as well. So staff members who provide, often provide services for individuals who've experienced traumatic events can also experience their own trauma as a result of that. And then just in the climate that we're living in now, the world that we're living in now with COVID and all these other things that are happening around us, there's a lot of trauma. A lot of people are traumatized. A lot of people are experiencing those types of events, in their lives. And these types of services, I think, are very helpful with that. Another thing to kind of think about, individuals that have behavioral health issues. If you think about a person that has a mental illness, the statistics for that person also having some type of trauma background or trauma history is great. It's more than 50%. So 50 to, I think it's 50 to 90%. And it is further complicated if that person also has a substance use disorder. So those percentages go up higher. And then if they've been involved in the criminal justice system, it's even higher. And then if they're also experiencing chronic homelessness, it's even higher. So, just about, and a lot of people that we work with, especially through this type of program, have all of those components. So you can just about guarantee that that person does have trauma history.
Wow. And as you mentioned before, all of that compounded can start affecting your physical health because
Exactly.
more often than not, you're not eating properly, you're not eating well as far as nutrient dense foods that are good to your body. You're probably not um, drinking enough water and using
Mhm.
other substances, as you mentioned. So there's this whole back and forth. Everything's intercorrelated, and it just starts creating this ticking time bomb within your body,
Exactly.
your mind, body, and soul, so to
Exactly.
speak.
The life expectancy for individuals that have mental health and substance use disorders is oftentimes a lot shorter than individuals who don't have those types of issues. And some of that is because there are some primary health related issues that are often associated with the presence of a mental illness, such as diabetes or hypertension. And then a lot of the individuals who have those types of issues, they're not very good about keeping their appointments. They're not very good about taking care of their health, as you indicated, exercising, eating right, don't know how to do those types of things, or need assistance, with those types of things. We find that, even within our client population, some of those, they don't keep their appointments with us, so we have to,
Well,
have some other strategies and unique services that are more targeted towards them to help to make sure that they follow up with their appointments, like care coordination and case management and things like that, to make sure they follow up. So if they're not keeping their appointments with us, it's very likely that they're not also keeping their appointments with the primary health care. And oftentimes, that's just in the conversation yesterday about this, and they were talking about that, sometimes they end up getting fired, from their PCP because they miss so many appointments. They don't keep,
well,
a lot of their appointments. And so, they go from one doctor to another doctor to another doctor, or they don't have a doctor, or they use the emergency room or the urgent care for their primary health care needs. They're not really planted anywhere.
wow. All right. So I want to say good morning to some more people that are checking in. And Christy has a comment. Good morning, Derek Coleman, Nakia Porter Casey, for checking in. And Christy says, yes, secondary trauma is real. So I want to get into with this clinic. Can you give us a rundown of how the services will operate? What can someone expect that says, okay, I need help, and let's begin a case. I don't know if it's a case plan. Like, give. I don't work in this field, so I don't know. I'm sorry.
So how does all
So
this
please,
work? Is what you get there. So the unique thing about this is as a community mental health center and also as a CCBHC or a certified community behavioral health clinic, we have a responsibility to provide care for individuals regardless of their ability to pay. So it could be somebody who's uninsured, somebody who is underinsured, somebody who has insurance. And it's also regardless of their um, location where they live. So they don't necessarily have to reside in our area. For CCBHC, they just have to be receiving services in our area. So we're through this project, primarily focusing on 3 counties, which are Craighead, Crittenden, and Mississippi counties. So the individual just has to receive services in those counties in order to, be eligible to participate or, to get the services that are offered through this particular project. There are non-essential services that are part of what CCBHC offers. So it's, crisis mental health and substance abuse services, and, individuals that, may have be suicidal, or they may be experiencing some type of hallucinations or some type of psychosis, I'll say. Screening and assessment is a part of that. Treatment planning is a part of it. Outpatient mental health services. So that's individual, group, family therapy, all of those services are available, as well as, day treatment services, and that's a little bit more intensive service. Targeted case management is a part of that. And so that's specific case management for specific types of populations. For instance, we have, school-based, that could be a type of case management. Through this project, we have implemented assertive community treatment teams, or ACT teams, which is another one of those really exciting pieces for me, something we had many years ago, and have been able to kind of revitalize that and start that again in those 3 counties. And those, the individuals, the population I was kind of mentioning earlier, that have those really complicated issues, or that are really complicated cases, the individuals that have mental health issues and substance use disorders, and they're involved in the criminal justice system, and they're homeless. Oftentimes those are the people who need the ACT services, because those are the people that, that ACT is targeted towards, trying to help them to maintain housing, trying to keep them out of the criminal justice system, which is very important. As you may know, we do some work with treatment courts locally here, the mental health courts and the veterans court and sobriety courts. And, it's a really big push to try to keep those individuals from cycling in and out of the criminal justice system, because the jails have become the new asylums, where people that have behavioral health issues end up being, housed, end up being kept. And it's a very costly thing for the community at large. And then, we're providing, as I mentioned, rehab, like day treatment services, and peer support is another piece that we're building up through this. So we've been able to hire some different types of peer support. So we have some peers who are specifically mental health. We have some who are co-occurring. So they have some personal history with, substances and mental health issues. And we have some peers who are specific to family. So we have family support partners, and that's a peer for the caregiver, which is something that I think is really good, because caregivers often need that type of support as they're trying to, if they have a youngster who is going through, the behavioral health system, is, having issues at school and having to try to get some additional assistance through the school district or DHS or DCFS or whatever it may happen to be, juvenile justice, just helping them to navigate through that. And then a youth support partner who is, a young person, or somebody who has had personal experience as a young person trying to navigate through these systems, who is also being a peer to another young person who is currently going through those processes. So, those are some great services that we're able to now begin to provide to our client population.
That's awesome. You just opened a whole nother door conversation there. We might have to extend this on Facebook just a little bit. Christy added some comments. She was like, she says, CCBHC, in the simplest form, to me, is integrated wraparound approach. This approach increases the likelihood of quality of life improvement. That's something else I want to touch on. Brad Hyde says Shadun Duncan is not only a vice president of ARISA, but he's also a licensed therapist and a great one. Thank you, Brad. Christy says CBHC services are for children, transition age youth, and adults. It's for everyone. This is what makes the program great. It doesn't exclude anyone. And good morning to Linda Johnson Frazier. And Keisha says support is crucial. Exactly. Yes, indeed. Okay, so I want to go back real quick. You mentioned that this program is for, is it Craig, Mississippi, Crittenden?
Yeah, Crittenden, Mississippi, correct.
And we know that Crittenden and Mississippi County are known to have higher populations of minorities. And so, again, going back to something in my class, we had a week where we, my focus for my class has been on health disparities. And so 1 week I focused on mental health and why minority populations are less likely to get the help they need. And one of the things that kept popping up in the articles I read was about mistrust in the system overall, and due to research and tools that have been implemented, they're not culturally aware. The tools are not, basically they don't fit the culture in most cases of the people they're supposed to be serving. The research, it often eliminates the people who need the service the most. So there's this gap and this lack of information on how to best serve all groups of people. I'm trying to be very PC and nice about this.
I think that was great, and actually a thought that I had this morning as I was at least mentally preparing for our time together. Yes, that definitely is an issue to consider, the needs of minority populations. There's a specific emphasis in CCBHC, for whatever reasons, federally is an issue, and it's a federal recognition for at least Native Americans and Native Alaskans, and then veterans. But there's also recognition of the need to have services that are catering also to minority populations and other vulnerable populations. And as you've kind of mentioned, minorities, and not just African Americans, we're looking at minorities also being Spanish speaking communities and others. They oftentimes do not seek behavioral health services. And I was fortunate enough to be able to be a part of a group last year before last, I think, and sharing. We were looking at Minority Mental Health Month, and issues that are impacting that, and just kind of talking through some of the reasons that minorities do not seek those services. And trust is one of those big issues. Sometimes it is also because they don't see other people who look like them providing those types of services. So one of the things that we're focusing on, or trying to focus on, is how do we recruit other staff and clinicians, providers that look like our client population. We want to make the makeup of our staff reflect also the population that we're serving, and having them to be involved also. So we're implementing, we do have a consumer advisory board, but we're expanding our consumer advisory board because we want to hear, what things work for them, what things they feel like we need, how, we can provide services that are more beneficial, more culturally sensitive and culturally specific. I think about, some young people that may, young youth or a child who may be African American. It's very hard, listen to me, it's very hard to find, it's very hard to find an African American therapist. I was just recently been hiring some staff, and just finding a male period in this field. And I get a lot of applications from females, and there's nothing wrong with getting females. But when you're looking at, somebody to try to pair that child with that young person with, it's sometimes trying to have some specific types of folks that we can pair them with is very important, and we don't always have those people readily available. So that is an issue. And then one of those other things that we kind of know, that unspoken thing, what goes on in this house stays in this house. And that's kind of been our thing. We were all, just about every African American person heard that. So you don't talk about the family business out in the streets, and so, or you don't take it outside of the house. And it was just kind of this understood thing. We'll handle it on our own. And sometimes that happened, but a lot of times it didn't happen. That our parents or whoever didn't have the tools to be able to successfully help us to navigate through that, to help us successfully be able to deal, to cope. And didn't really know what to do with those types of things. I've had a number of people, I've done this for a long time and have heard many stories, and I've had a number of people that I've worked with that have said, they were kind of isolated. They were in the house, they were with the family, but they were kind of isolated, and so you start looking at socially, they didn't really have those connections, they didn't really have those relationships, and that thing kind of perpetuated on as they grew up. And then if they in turn had children, then they didn't really have, some of them, good relationships with their children. So there are a lot of these types of things. Religious beliefs play a role in that as well. And some people have a problem trying to mesh and understand the two together, that God can heal, but you also may need to take your medication too, until God gets finished healing, and then the doctor confirms that you've been healed. And so, there are a lot of those different types of things that people sometimes struggle with that really prevent them from seeking those types of services.
I should have reached out to you when I was working on my assignment a couple weeks ago, because you have touched on so many things that I came across. So for those of you listening on air, I apologize, we're going to have to end it here, but we will continue on Facebook for a little bit because we have some more comments that came in. And I want to just, briefly wrap up our discussion. So for those of you, again, listening on air, you're going to jump on Facebook to catch the last little bit of this conversation. I want to thank you, Mr. Shadun, for coming on and for sharing this information. So again, Community Behavioral Health Clinic.
Yeah, certified Community Behavioral Health Clinic. I forget the certified part.
Certified at Mid-South Health Systems. Doesn't matter what your ability to pay is, where you are, what's going on in your life. Please reach out, get the help you need. do not go untreated. So, but again, we're going to switch to Facebook. Okay, so we're still on Facebook,
Okay.
but I just wanted to kind of piggyback off what you were saying because it's so vital and it's so important. Again, this came up in my research. The minority community are less likely to self-disclose mental health issues and things they're facing, going back to that lack of trust and then lack of representation, feeling that, okay, I'm talking to this person who doesn't look like me. How can they possibly understand
Mm-hmm.
what I'm saying, what I'm dealing with, without trying to treat me from a clinical perspective versus a different perspective? Like, it's one thing, okay, yes, and I don't know what the name of the book is called, where you diagnose people,
Yeah, your DSM.
Okay, so it's like this person tells you XYZ, you go to the book and say, okay, well, that sounds like this disorder, and then you treat them according to a standard,
Mm-hmm.
and everyone does not fit into that little box. And so
Exactly.
you have to take a different approach with every person.
Mm-hmm.
So,
And that was one of the things, I remember from my graduate studies and going through, I think it was cultural psychology or something like that. And they were talking about treating each individual as a culture of one. So even within different, ethnicities and different cultures and backgrounds, there's still variation. Within every family, everybody's not exactly the same. So you have to treat every person as that person, that person is. And I think a part of being culturally competent is also understanding, people bring different nuances and experiences and backgrounds other than just their culture, their skin color, their race, their sex or gender, sexual orientation, all those types of things. They bring more than that to a session. I'm just kind of thinking about a person that we had an experience with one of our courts, and just in interacting with that person, you would assume this is just a very angry person, but when you got to experience their home life, you saw that's just how they interacted. They all yelled at each other and hollered at each other and cussed at each other. That was the norm, for them. So
oh,
it wasn't this person being this aggressive, mean, person. It was that's what that person grew up in. That was the culture, the attitude, the personality of their home, of their family. And that's just how they did things. And it wasn't like, the norm. And over time, that person kind of mellowed out. But, it was after understanding this is where this person came from and this is how they do it. It's like, oh, light bulb came on. Oh, this is what this really is. It's not this person is aggressive, but it's really, it's something different from that. And sometimes I think that's how it is with, when people just see certain ethnicities and cultural backgrounds, you just have these automatic assumptions, these beliefs, these biases that we can very easily attach to that individual or that race or whatever it is, and just make certain assumptions, and they're not necessarily true.
well, I'm glad you brought that up, and hopefully we have somebody from LEAP talk about this. But they're going to actually be doing another seminar about that very thing, about trying to eliminate those biases that we in the Black community are guilty to. We can look at someone
Yeah.
else that's in a different I'm just gonna say social economic status than us,
Yes.
educational status, whatever the case may be, and we're quick to want to pass judgment, whether we want to admit that or not. We are passing judgment based on our lens that we view life through.
Exactly.
And that's unfair to that person because we don't know, as you mentioned, we don't know what the underlying issues are. We don't know anything else about that person than what they present in that very moment.
Exactly.
We have we have some comments here. I'm sorry, y'all, I'm not ignoring you. Um, Brad Hyde says, you don't have to live in these counties to receive the services. Someone in Poinsett County or surrounding counties can also access the services. Um, but with this particular clinic, is it just for those three or will it expand?
So our hopes are, once this grant cycle ends, that we'll be able to reapply, and we want to be able to expand it to other counties.
Okay. All right. Ms. Linda says it does help them to open when they see someone that looks like them. Going back to the topic about what I call representation matters. In
Mm-hmm.
every aspect of life, in any field, representation matters.
Yes.
Um, and then Christy says, yes, there's still variations. I'm sorry, I don't know what that was in reference to. Um, and Linda says it's the cultural difference. Keisha says, yes, cultural dynamics. Yeah, that in mental health, any field, I don't
Hmm.
care what field it is, cultural, yeah, I'm just gonna use Keisha's word, cultural dynamics. It matters. Cultural diversity,
Yes.
cultural awareness
Yes.
matter. Cultural awareness, cultural sensitivity. Christy says automatic assumption breeds unhealthy stigmas and prejudice. Another big thing that keeps minorities from getting the help they need. Because once they disclose, I need help, then other people who feel like they have their life all together are kind of like, what's wrong with you? Then they start getting viewed differently.
Yes.
Like something is wrong and
Yes.
broken. Well,
Yes.
something is broken, but you
Yeah.
know,
People don't want to be stigmatized. They don't want to be shunned. They don't want to be looked down upon because they have an issue, because they're struggling with something. We've had to, with certain things, learn to rephrase how we're asking certain questions and how we're, making certain statements to them to try to, get the information that we're needing. Because people don't want to be stigmatized. Just, as I mentioned earlier, with our work with the court, we would have to, screen people that possibly had mental health issues. And what we found, something that I saw early on in just doing some of these screenings, is that a lot of these people were more likely to be willing to be identified as having a substance use disorder than having a mental health issue,
wow.
which I thought was really, really interesting. But it was like, I guess maybe just the thought, the feeling that having a substance use disorder was more acceptable, was easier to explain. People would kind of be able to understand it better than being able to try to understand this person has a mental health issue. And, sometimes just the thoughts around the mental health issue, a lot of people don't really have good understanding about it. They will, just assume it's a matter of the will and the person should just be able to get over it, or they're just faking, or there's nothing really wrong with them, or some of the not so nice ways that people may refer to or describe a person that has a mental health issue, considering thinking that they're dangerous, that they're going to hurt you. There are a lot of things that are associated with that really makes it very difficult for people to be willing to come forth and say, hey, I'm struggling with something and I need some help, because being afraid of what's going to come along with that in society.
Yes, sir. And I want to also mention this, and I know we got to wrap up, that mental health issues, they range from mild to extreme. So another thing, maybe this is definitely a conversation for another day, how to recognize when it's a real disorder versus I'm just having a bad day. Because I don't want to call them bad days. I have days where I don't want to turn the lights on, you know, and I just want to be completely dark and quiet. And I just need that time for about 2 or 3 hours, and then I'm okay after that. Or I might have a whole day where I'm like, I don't want to talk to anybody, but sometimes in those moments, someone maybe need to talk to someone and just talk out those emotions, because what I've learned is those small moments can lead to bigger moments.
Yes.
And you eventually fall into a cycle. And I'm not a clinician, I'm not a therapist, I'm not any of that, but this is personal observation.
Yeah. Mental health issues can impact anybody. Anybody. It doesn't matter. Mental health issues don't care your race, they don't care your religion, it doesn't care about your social economic status, it doesn't care about your background, which neighborhood you live in, what city you come from, who your mom and them are. It doesn't really care about any of those types of things. Anybody can experience that. And just because you experience a mental health issue doesn't mean it's a lifelong issue. If you experience the loss of a loved one, it's very possible. You could be struggling with depression. You could be struggling with some levels of anxiety, and need some grief counseling or somebody to kind of help talk through those things. And honestly, a lot of people are experiencing that right now with all of the deaths that have happened related to COVID and all these other things that we're seeing going on, the social and racial unrest that we're seeing. A lot of people have experienced those types of issues, having, trauma, whatever that may happen to look like. It could be, you were a victim of some type of domestic abuse or violence, or that you witnessed it. It's traumatic still. seeing it on TV, stuff that's very popular, in the news, and that we're still kind of trying to work through as a country. Very traumatic for individuals. And so those can be specific instances. I think the thing that kind of really distinguishes it from being a mental illness, from being maybe somebody who may be struggling or maybe experiencing a crisis at the moment, or who may be having a mental health issue, is the duration, how long it's lasting. It's how it's impacting the individual. So if it's starting to inhibit their ability to function, if it's, truly a chemical imbalance, and that's what we start looking at. We're talking about things like, major depression or schizophrenia or bipolar, things like that. Those are chemical imbalances. So an imbalance of the chemicals in the brain, and they need some medication to help to, level them out, help them to function. And definitely there are benefits in therapy. If you're just having some issues with adjusting, any major life challenge, it could be, you went through a divorce or a big breakup, or it could be, some other thing that happened in your life with your family. You just kind of need somebody to talk through it. Just because you go talk to a counselor or a therapist does not mean that there is something wrong with you. Sometimes we just get stuck and we need somebody to help us to figure our lives out, and to be able to move on to what the next stage or the next step is for us. So it doesn't, I think some people have that kind of thought, oh, I gotta go talk to a shrink. Like, is your head really gonna get smaller because you want to talk to somebody? It just really, they help me to figure out what's going on. And then really just, just from my grad school experience, they encourage the therapist to have somebody that they talk to. I go talk to somebody, have had difficulties and situations that have happened in my life, and I just need somebody to help me to, figure things out, and, how to move forward with my life. So, everybody, can have those types of incidents. And it may not necessarily be that you talk to a therapist. It could be, get some pastoral counseling. It could be that you do go see a mental health provider. It could be you go, see a psychologist or whoever. But definitely, if you're struggling, I strongly encourage you to talk to somebody.
All right. Well, thank you. I want to read the last few comments, and we're going to have to wrap up. Miss Linda Johnson says stereotyping before getting to know. That goes back to making assumptions about people. She said, cue that's those days where you need to decompress. Sometimes you just need some me time, most definitely. But I'm slowly finding myself needing more me time, which is not healthy either.
Yeah, and if you know yourself, you'll know. If you're being aware, practicing being aware, you'll know when, okay, this is okay, but this right here is not okay.
Yeah. Ty Jackson says, we have to normalize mental illness, make it okay, most definitely. And Chrissy says, I talked to someone too. A little bit of self-disclosure here. I have been seeing a therapist for over not quite a year. And I must say it has been helping a lot. And it helps too. I want to say this to people who are questioning getting any kind of mental help. It doesn't necessarily say something is wrong with you.
Mm-hmm.
It just says that you need to talk through some things, because how you're functioning in your life presently is affected by past issues. We talked about trauma earlier. And by talking to a therapist, I was unable to unlock some things and cry through some things.
Yeah.
Yeah. And then once you work through and you unlock, okay, there's a movie I watched, and I'm gonna not, the name is not coming to me, but it's basically like the second edition of the movie. When Jack Nicholson was he went crazy at this. Okay, The Shining. It's like years later, another edition of The Shining. Anyway, so this man was having some issues, and so he would go into his mind. There was these foot lockers, and they were all locked, but eventually started popping open, and it was stuff that he had suppressed. So that's what I think of when I'm thinking about seeing a therapist. I'm unlocking all of these boxes and eliminating that stuff.
Helping you to better understand you, why you are, how you are, who you are, what you do, why you do what you do, and then how do you be able to figure out how to move forward. I personally, this is my philosophy. I personally believe that people have within themselves the answers to their problems.
Mhm.
We are the expert on us. We've been figuring out our lives the whole time we've been alive. Okay, so we figure it out. And it's just when we get stuck, then we start experiencing, this distress because we don't know what to do about this, and we don't know how to move forward with that, or we're having some type of emotion that we really know why we're having that emotion, or some type of situation we really don't know why we're dealing with that situation, or why we feel the way we feel about it, or react to it the way we react to it. And sometimes we need somebody to help us to understand those particular
Yeah.
things, as you said, to help to unlock those doors. Then you're like, oh, that's where they came from. Oh, that's why this is this. So I have it before me now, not within me like that. It's not in me controlling me. It's out before me. I can see it clearly. So now I can kind of better figure out how I need to approach those types of situations.
Yes, most definitely. Okay, I know we keep saying we're gonna wrap. This has been you say you didn't have a lot to talk about. Look, you haven't sat down with me yet, so but I just want to thank you. More comments real quick. Keisha said yes, it's okay to ask for help. We all need it. Chrissy says sometimes you need help processing to move forward. That's what therapy/services are to me. Brad says, thank you for disclosing that you see a therapist, Kabila. I don't think you know how many people you are helping by just saying that. Well, thank you.
Yes,
um,
exactly.
Linda says it involves the things we can't control.
Mhm.
And Christy says, Brad Hyde comments was fabulous. Everyone's experiences a life-changing experience or depression in their lifetime. And thank you, Keisha said it's an amazing conversation. So we're gonna have to pick this up again. We want to definitely remind everyone May is Mental Health Awareness Month, but people who are dealing with mental health issues is 24/7, 365.
Yes.
So don't just wait to May. Advocate, educate, and then advocate. That's one of my mottos. Educate yourself and then advocate for someone you love. So
I want to mention
educate.
this before you wrap up. We offer mental health first aid, and that's a training to help people to become aware of the signs and symptoms of a mental health issue or mental health crisis and how to help somebody who may be experiencing that. So
Okay.
now we also have a grant for that. So we offer that free of charge. If there are people who are interested in something like that, we definitely can make that happen.
Look, we definitely need to have more conversations and get some community partnerships going because we need that. We need to break these stigmas. We need to break the chains. We need to start healing our people. Our people need a healing.
Yes.
That's a whole nother conversation too. Our people, not just our people, Black people, our people of this entire nation
Yep.
need a healing.
I agree.
And that goes beyond. Okay, I'm gonna stop because I get on the soapbox. I get passionate. So anyway, but thank you, Shadun, so much. Thank you, every single person who chimed in. Thank you for your comments. Miss Christy, she's always number one supporter. Thank you.
Yeah, that's part of my wonderful, wonderful, wonderful team. I shout out to them. Those are my folk, my people.
So thank you to everybody else. We need to have a sit down, a panel discussion with you and some of your other therapists that work at the facility to have a deeper discussion about this thing. So thank
That would
you
be
so
great.
very much.
Yeah, that would be great. Well, thank you for the opportunity.
All right. Thank you everyone for checking in on Facebook. This has been Thursday edition of Community Conversations. Tune in tomorrow for another guest. I hope everyone has a great and blessed day.
Thank you.
Okay.